convention is just absolutely amazing.
Very exciting.
It really energizes me.
It's cool meeting other people and hearing their practices.
One thing that I do for myself every single year, I take a week and you get to learn.
Everything I learned I can immediately put into practice.
Sharing science, finding solutions. In September 2010, more than 3,200 nurses and professionals in the AWHONN community met in Las Vegas for the 2010 annual AWHONN Convention.
It's very empowering to be with this many nurses and to realize that things can change.
The things that we learned here today will make a difference in our perinatal care
and keeps us current to make sure we're practicing within our guidelines.
I think it's one of the cheapest ways to bring back evidence about new practices.
Nurses and professionals in the field came to learn, network, share best practices, and the message is clear. Nurses are making a difference with mothers and babies.
We come to these events so that we can become better nurses.
I come and attend the AWHONN Convention because I want to stay on top of the perinatal safety initiatives.
I come because of the networking.
I'm excited for the breastfeeding workshops that they have here.
Working to prevent needless death of women and their families, opening general session speaker Dr. Leslie Mancuso is a leader in public health, bringing accountability and change throughout the world.
First, I want to thank all of you for the privilege of speaking in front of 2,800 nurses, my colleagues. It is indeed my honor.
Other general session speakers included a healthcare reform update from Rebecca Patton, emergency room specialist Carlos Camargo, and a moving presentation on breast cancer by Jean Collins Glaive, who is living with the disease.
Every time I stand to speak, I do so as a tribute to those who are fighting the disease, those who have fought the disease and won, and those who have fought the disease and lost their lives, and those who love someone going through the disease. These are my heroes, and I honor them.
The AWHONN Exhibit Hall is the crossroads of practitioners and vendors to the field.
We have a voice. Vendors love nurses. They love hearing our opinions. They're making things that we're going to be using at the bedside, and they're really excited to take their innovative ideas, and they want to know what we think.
Love the exhibition hall and seeing all the vendors and all the newest, latest technology.
The vendor hall is really important. I mean, as a director, I need to know what the products are that are coming out. So when my nurses come back and say, Ed, I saw this really cool thing, I can go, yeah, I saw it too. Let's see what we can do and how that can help us with our patient care.
Because it's a great organization, we pride ourselves in education and also products that your healthcare professionals, your nurses can use.
Well, we exhibit at the AWHONN Convention because it's just a great way to give back to all of the nurses and the hospitals that we do business with 365 days a year.
This year's information-rich educational sessions were packed.
I really enjoyed our last presentation that talked about Pitocin protocols.
I am expecting to get some tips to take back to my unit so that we can better prepare for these type of emergencies.
It's always good to hear other people's stories, so when it comes up in your case, you'll know what to do.
The number of CEUs that I get at an AWHONN convention far outweigh the number of CEUs I get at any other convention.
This session we just finished up here was amazing.
I have really enjoyed the poster presentations. It was great having the presenters on site to ask them questions.
AWHONN also honored its brightest and best. They are those who have contributed to and bettered the AWHONN field of nursing. And I'm still committed to AWHONN. I'm very passionate about the work of the organization. And I'm very committed to making sure that we have the best and the brightest staff. You can't come to Las Vegas and not have fun. And nobody has a better time than the members of AWHONN.
I am. I'm looking forward to Fire and Ice tonight to see how nurses get down when, we're out of session. So it'll be interesting.
I joined AWHONN because I wanted education.
This is the organization that guides the way we practice.
We are fortunate in the maternal child specialty to have such a strong organization.
They know, OB nurses, what will save 80% of all mothers' lives.
I've learned a lot.
I've really enjoyed the big sessions and listening to getting a bigger picture worldview.
It's just so nice to be able to network and meet people from all other areas that are doing some of the same things.
That was very inspiring and gave us hope that we didn't have before. We gave us ammunition to take back to our administration so we can get the safe staffing numbers that we need.
Join your nursing colleagues in Africa and Asia, in Latin America and Canada and Europe. Join your nursing colleagues and be the change that you want to be in the world. Thank you.
AWHONN invites you to the Mile High City for AWHONN 2011. We'll see you there.